People will get hurt and people will die.
I think it's incredibly disingenuous. I think people need to understand what is being debated in Congress to begin with.
Josh Archambault is a senior fellow at the Pioneer Institute. His expertise is in healthcare, spending nearly 2 decades working on health policy issues.
The bills that have been passed through the House in Congress actually spend more money on Medicaid, not less. There's no cut. The cut, if you will, is a slowing in the rate of growth. They're still going to spend more money on this bill.
Archambault's comments follow a recent presser held by Governor Healy, along with Senators Warren and Markey, who feigned outrage about what they call cuts to Medicaid in a recent bill passed by Congress.
Only in D.C. do you get a situation where a cut, it means more spending. And as a result of this, if this ends up passing the Senate, gets signed into law, the state will have to, for the first time in a very long time, prioritize spending, looking at what populations it wants to spend the money on. It'll be up to Maura Healey when she's in office, if she's in office, to determine, does that go to nursing homes, does that go to the disabled, or do they continue to prioritize non-disabled adults, which is where most of the growth has come over the last 20 years.
250,000 people in Massachusetts will lose their health care coverage.
Some of the estimates of lost coverage is because people are going to make more money and not qualify for the program anymore. There's a focus on looking at volunteering or work requirements for the able-bodied population. I think most citizens of Massachusetts would celebrate if somebody was making more money. Either that means they go into private insurance on what we call the connector, or that means they get coverage from their employer. That's a victory. That's not a loss of coverage. So I think a lot of the estimates have been quite disingenuous.
It makes no sense from a healthcare point of view and no sense from a cost savings point of view either.
Over the last 20 years, our population has grown 11%, but yet now 30% of the state population is on Medicaid or MassHealth. We've seen a 255% growth of non-disabled adults on the program. That's where the explosion has come. We're spending $22 billion a year in the state of Massachusetts, and the research shows that people's health are not improving. For decades, we haven't spent all of the attention by our leaders on improving health. It's been about protecting federal revenue, and that's just missing the mark. Medicaid or MassHealth is for the most vulnerable, and the only way that we're going to be able to make that program sustainable and live up to our promises is fundamental reform.
The Fiscal Alliance Foundation is a nonpartisan nonprofit 501c3 organization. Visit our website to read more about our alternative energy policy studies, sign up for important email updates, make a tax-deductible contribution, and follow us on social media.